Good morning, Chairman Landrieu and Ranking Member Snow. I appreciate the invitation this morning to share a little bit of our story with all of you. I'm Joe Hernandez. I'm Chief Executive Officer of Signal Genetics. I also am the Executive Board Member of the Maryland High Tech Council and reviewer for the National Science Foundation for the Engineering Resource Center that they fund on an annual basis. I'm privileged to be here today on behalf of the biotech industry organizations, more than 1,200 companies, academic institutions, state biotechnology centers, and related organizations in all 50 states. We are involved in the effort of developing and further advancing the technology in healthcare, agricultural, environmental, and industrial biotechnology. In my career, I've had the privilege of being involved in some exciting cutting-edge technologies. I am a lot older than I look, I promise. I was involved early on in my career in Silicon Valley with the DNA microarray, which is technology that's revolutionized the way we look at genomics and genetics. I've also was involved with a Maryland company by the name of Digene that commercialized the first molecular test for human papillomavirus, the causative agent of cervical cancer. I have been, in my more recent career, I have founded a number of companies and have had the pleasure of licensing technologies from universities, raising venture capital, applying to SBIRs, and commercializing products, all of which have created hundreds of jobs in the companies that I've been involved with. I currently run a company that is focused in the area of personalized medicine for multiple myeloma. This new revolution in science is will allow for individuals to get better therapeutic treatments, as we know their genetics and the makeup of their genetics and how they ultimately respond to therapy. The advantages are better outcomes for the patients, but also more importantly, better economics for our healthcare system. It is with this background of experiences that I offer my comments today. You know, the SBIR program, as been mentioned here before, has played really a critical role in bringing amazing innovations to the American people and created great enterprises and employed a number of people. Unfortunately, the effectiveness of this program is really threatened, if not modernized, to address the current realities of the marketplace. Congress created this program, as you know, in the early 80s to help companies overcome the valley of death. The realities of the market and the economy is that this valley has become deeper, longer, and now we call it a canyon of death. It's really a very brutal place. We need to support this high-risk, high-reward research. We want to take advantage of the basic research investments that we've made as a society in places like the NIH and academia. It's important that we leverage those investments. It has an enormous benefit to patients and society at large, and I would argue that if you look at some of the great innovations, at least in biotechnology, a lot of them had its genesis within the SBIR program. For 20 years, the small domestic biotech companies have competed for the SBIR programs, but in 2003, the SB Office of Hearing and Appeals ruled that a company did not meet the size standard because multiple venture capitalists own more than 50% of the company. The reality is this case ignores the reality of these marketplaces. In the biotechnology industry, it takes us 8 to 12 years to develop a product. It takes us $800 million to $1.2 billion. Those are real numbers. Obviously, that cannot be done with SBIR dollars alone. It requires the involvement of outside investors in the venture community. The disturbing trends documented since the majority of VC-backed companies were excluded are actually quite alarming. The NIH notes that there's been a 40% decline in applications between 2004 and 2008. 2009 was the lowest number of small business participants in the SBIR program in a decade. The impact of the recession, the financial crisis in the biotech industry has been enormous. According to the National Venture Capital Association, for these last 4 consecutive years, the VC funds in the U.S. are declining. There's less investment, less risk-taking in the venture community at this point. Thomson's Reuters study found the crisis caused 80% of biotech companies, investors, to change their strategy. The number of public biotechs has fallen by 25% between 2008.
You got 30 seconds, please.
The SBIR authorization must be reestablished, the eligibility for small VC-backed companies. It's imperative that we do that. And the award should provide to companies that provide the best science in their development. We are, the SBIR reauthorization must clarify the SBA affiliation rules so that small companies can reasonably ascertain if they're eligible for the program. Lastly, BIO supports the SBIR authorization compromise reached at the end of Congress. We support the Senate passing this legislation. The bill improves access to SBIR at NIH, DOD, NSF in particular. The bill clarifies SBIR affiliation rules in a way that gives peace of mind to small companies. We hope an SBIR authorization bill will be assigned into law this year. Thank you for your time.